Just how damaging will this be for the NHS?
Well, every time there is industrial action, it causes a huge amount of disruption in the NHS. But seeing the consultants going out on strike, particularly just a day after a 5-day period of junior doctors going out on strike, is going to be something that we haven't seen before. Consultants haven't taken industrial action for more than a decade. So in a post-pandemic world, I guess, we don't quite know what's going to happen. What's important to understand is when other parts of the NHS go out on strike, quite often there are other people that are able to provide temporary cover. When consultants go out on strike, it's not just their own work, but it's also that they're required to supervise quite a lot of other work. So it's going to have a really significant impact that I think a lot of patients will feel, particularly in terms of having to postpone quite a lot of care that they might have had otherwise.
So junior doctors will be working, but they won't have anybody to mark their homework?
That's right. The way it works in the NHS is that the consultants provide supervision across all the doctors, and that means that if there are particular things that would need to have that specific supervision, then that might not be available. Now, what we do know is that consultants are providing some cover in that they describe it as Christmas Day cover. So those most urgent and emergency of care will be covered, but what won't be covered is the planned care, probably, in main. Obviously, if you've got an appointment and you haven't heard anything, then hopefully that is still going ahead and you should continue as planned. But lots of people will have not had their appointments scheduled, or some might have had them postponed.
What does it mean for waiting lists?
Well, everybody's working incredibly hard to reduce the waiting lists, but clearly what this means is that lots of procedures that would otherwise have taken place and being able to remove those from the waiting list, get people the care they need, will be postponed. It's really frustrating for everyone.
So the Prime Minister, in Prime Minister's questions yesterday, blamed the extension of the waiting list, the NHS waiting list, on doctors striking.
I mean, I think there's a lot of things to blame for the waiting list being the size that it is. It's incredibly frustrating. It's frankly been going on for many years. There's been lots of exacerbating factors, from COVID to various winter pressures and flu, but it is the case that industrial action is likely to be playing its part in that too.
Do you think there will be as much sympathy for consultants striking as there is for junior doctors?
I mean, it's hard to say. I think everybody who's working in the NHS has the right to have their concerns about their working conditions heard and addressed. So that's what's happening at the moment, just as we're hearing from nurses, from radiographers, from junior doctors and from consultants. It is a real challenge at the moment in the NHS, and people do deserve to be heard as to what is done about that. That's really a matter for the unions and the government.
It sounds as though you have sympathy for the consultants.
I mean, I think that we hear from our members who are leaders across the NHS that everyone has sympathy for all workers who feel that they're not getting a fair deal and want to see people working in a situation that they feel happy and comfortable about. There's a huge challenge for recruitment and retention in the NHS at the moment. It's incredibly important to make sure that people are working in a good, positive way that is good for them, good for patients.
What do you want the government to do?
Well, all NHS leaders want the government to get this sorted out. This is not something that can go on indefinitely. We've already heard the consultants planning a further strike later. It may be the case.
How do you feel about that?
Well, it's really worrying because every time there's a strike, huge disruption, impact on waiting lists, impact on patients, impact on staff morale, impact on the many people who are working so hard to plan to keep up patient safety during those strikes, when they could be using that thinking and planning time to be improving, transforming, making services better for patients. It's really frustrating for everyone.
I suppose my viewers this morning will be thinking, if somebody earns well over £100,000 a year and they've got more than £1 million in their pension pot, should they really be going on strike?
Well, I mean, that's not for me to say. That's for them and their unions.
View.
I mean, what my personal view is that everybody needs to be able to express their views and their concerns about their working conditions, and for that to be heard and to find a solution so that we keep the NHS going, so that we can address those waiting lists and so that we can have motivated, happy staff delivering excellent care for patients.
How far away are we from that?
Right now, it's not clear what the way forward is going to be. And we really need to look to the government and the trade unions to find that way forward.
When were you last aware of NHS staff being happy? They've had a torrid few years.
It's incredibly difficult in the NHS. If you think about things like, one of the reasons that it's so challenging is that there's so many vacancies at the moment. I think about 112,000, I think, at the moment. That's a huge number of vacancies. And the people who are working there are, of course, having to cover that work. Then there's been this real lack of investment in capital. So they're working in conditions where, you know, there might be leaking roofs and faulty equipment and other things that are getting in the way of them being able to deliver the very best care. And then all these challenges around trying to discharge patients. But actually, there have been real difficulties flowing through the system and getting people out of hospital and getting the care that they need in the community. There's lots and lots of things that make life very difficult. Clearly, the pandemic did exacerbate that. But these are challenges that have been going on for a long time. And we're hoping that the new workforce plan will go some way to alleviating that. But at the moment, it is hard in the NHS.